The Nigerians in Diaspora Commission (NIDCOM), under the leadership of Honorable Abike Darberewa, has unveiled the Diaspora Health Impact Initiative (DHII 2026) at a press conference in Abuja. The Diaspora Health Impact Initiative will bring together diaspora doctors, nurses, and other medical professionals to carry out medical interventions in 6 regions of the country from July 20th, 2026, culminating in the grand finale on July 25th and 26th, 2026 in Abuja. We will bring to you details of the press conference and interventions across USA, Canada, United Kingdom, Europe, Asia, Australia, Africa, and others. And do not forget our complimentary segment of Health Tips by Association of Nigerian Physicians in the Americas, our Food Corner, as well as our Diaspora of the Moment. This is your favorite show, The Diaspora. I remain Juliana Vincent Yakubu, your anchor. Please stay. Welcome back. Let's begin with the DHII 2026 press conference with the NIDCOM boss spotlighting.
This initiative is scheduled to run a week before the National Diaspora Day 2026 celebration, which comes up every 25th and 26th of July. And our theme this year is Harnessing Global Diaspora Medical Expertise to Strengthen Local Health Systems for National Development. Nigeria has a pool of highly trained diaspora health professionals who continue to make significant contributions to global healthcare systems. Beyond financial remittances, which exceed $20 billion annually, their knowledge transfer, specialist care, mentorship, and systems expertise represent a powerful tool for national health transformation. DHII 2026 provides a coordinated framework to align diaspora expertise with priority national and state-level health needs, particularly in underserved communities in Nigeria. So NIDCOM, in collaboration with key health sector stakeholders, we have made steady progress in integrating diaspora expertise into national development. Through the National Diaspora Policy, structured engagement mechanisms, diaspora data mapping, and partnership with federal and state institutions, diaspora health professionals are increasingly contributing to medical outreach programs, capacity building and skills transfer, health education and mentorship, policy dialogue and advisory roles. Can we appreciate them for all this? So DHII 2026 consolidates these efforts into a focused and sustainable health impact framework. So what are the objectives of DHII 2026? Here they are. Number 1 is to strengthen healthcare service delivery through targeted specialist medical interventions across selected states. Facilitate sustainable knowledge and skills transfer between diaspora and local health professionals. Improve access to quality healthcare services in priority communities. Enhance clinical governance, leadership, and health systems management at state and institutional levels. Promote the adoption of innovative medical practices, technologies, and diagnostics. Foster long-term partnerships between diaspora and medical associations and Nigerian health institutions. Generate evidence-based data to inform national health policy, planning, and reforms. So who are our strategic stakeholders and institutional collaborators? They are, topmost, the Federal Ministry of Health and Social Welfare. And again, I want to thank the Honorable Minister of State for Health, who is our leader of this, and of course the Minister of Health, Dr. Pate, who himself is a diasporan and has won the National Diaspora Merit Award. The Federal Ministry of Education, with Dr. Tunji Alausa as Minister, who has come up with a bridge program, one of the very best, and also a very, very successful Nigerian in the diaspora that has returned home to serve. The Nigerian Medical Association, I mentioned them earlier. Thank you so much for your partnership, for your support, for your guidance, for your knowledge. The Medical and Dental Council of Nigeria under Dr. Fatima Kiari, I thank you very much. Operational delivery will be led by reputable Nigerian diaspora medical associations, each assigned to specific states of intervention within geopolitical zones as follows. Now we have the Association of Nigerian Physicians in the Americas, USA. The diaspora lead is Dr. Cliff A.K. When I mention their names, please clap for them. States and training locations for AMPA. AMPA is based in America. There will be Imo State, Abia State, and Enugu State. AMPA will be coming in much earlier before the Diaspora Week to carry out the medical missions, which they've been doing for the past over 30 years. They celebrated 30 years last year. A round of applause for AMPA, please. So, and then they will be doing medical interventions 20th to 23rd of July 2026. From Canada is CANPAD, Canadian Association of Nigerian Physicians and Dentists in Canada. The diaspora lead, Dr. Itwa Iriogbe. Dr. Itwa, thank you very much. And CANPAD specialist interventions will be medical leadership, health governance, health systems strengthening. They will be holding their states and training locations in the Federal Capital Territory here in Abuja. And the dates of the medical interventions, 20th to 23rd of July 2026. Abuja, are you ready? Then we have the MANSAG. That's the Medical Association of Nigerians across Great Britain, MANSAG, in the United Kingdom. The diaspora lead, Dr. Jide Menakaya. And their specialized interventions will be ongoing online advanced specialist lectures in key clinical areas. Like I said, the lectures have been ongoing. We keep circulating it on our website, on our social media platforms. You don't have to be a medical person. Please register online and participate in these lectures. They are very, very beneficial. Maternal, newborn, and child health, MNCH, also obstetrics and neonatal care. Now they will be choosing states and training locations will be Kano State, Kaduna State, and Sokoto State. So Kano, Kaduna, Sokoto, are you ready? The dates of the medical interventions will be 20th to 23rd of July 2026. Then we also have an NGO, the Concerned Medics Foundation, based in the United Kingdom, that have been very, very active. Their lead is Dr. Sadia Gumi Bennett. And their specialized interventions will be in sickle cell disease screening, diagnosis, and clinical management. Their state and training location will be Borno State. So Borno, are you ready? Again, their dates of medical interventions will be 20th to 23rd July 2026. Then we have the Nigerian Medical Association Germany, NMA Germany, under Dr. Miriam Adamu. Their specialized interventions will be, again, ongoing online advanced specialist lectures in key clinical areas. Again, that is taking place. You all have to enroll and listen. Women's health screening in cervical cancer pilot, point of care ultrasounds, POCUS, echocardiography. They will be choosing the following states for their training and location: Federal Capital Territory, Abuja, and Nasarawa State in Kefi. Nasarawa State, are you ready? The dates of medical interventions, 20th to 23rd July 2026. Now we move to Australia. Nigerian Australian Medical and Dental Association, NAMDA, Australia. The diaspora lead is Dr. Uche Menakaya. Their specialized interventions will be, again, ongoing online advanced specialist lectures in key clinical areas, endometriosis care, reproductive health diagnostics, and women's health. The states and training locations will be Bayelsa State, Edo State, Benin City, Akwa Ibom State, Uyo, Rivers State, Port Harcourt. So South, are you ready? Their dates of medical interventions, 20th to 23rd July 2026. Now, we come closer to Africa. The Nigerian Doctors Forum, South Africa, NDFSA. The diaspora lead is Dr. Kunle Akombi, and their specialized interventions will be interventional radiology, neurology, and gastroendoscopy. State and training location will be Lagos. Lagos, are you ready? And the days of medical interventions, 20th to 23rd July 2026. Now, these allocations ensure nationwide reach across multiple geopolitical zones. As you can see, all the 6 geopolitical zones are being covered by medical practitioners.
Honorable Abike Daberewa stressed further that all participating associations are expected to reconvene in Abuja on July 24th, 2026, ahead of the National Diaspora Day, to submit outcomes from their various interventions.
At the conclusion of the state-level medical interventions, all participating associations will return to Abuja on the 24th of July 2026. The 7 medical associations will formally present and showcase the outcomes, impact data, and lessons learned from the interventions during the National Diaspora Day 2026 celebration on the 25th and 26th of July 2025. This national showcase will support policy dialogue, accountability, and the scaling of successful models for the future of Nigeria's healthcare sector.
Various medical experts and professionals, both at home and in the diaspora, spoke with dogged commitment and optimism towards the success of the DHII 2026.
The key aspect of the work we're doing collectively, the 7 of us collective groups across the diaspora, is that we continue to build on this moving forward. And I'm really excited that my colleague, the chairman of the Doctors for Change, Doctors for Change is also in the room, and I'm sure we'll be working with him to build that expertise moving forward. So I'm grateful to Honorable Chairman for really highlighting the importance of that global community coming to work with Nigeria. And I know that all of us and all our associations really want to see that this vision happens, and will continue to work with you and all the partners to ensure that we sustain this moving forward.
This Diaspora Health Initiative, I think, is very welcome. And as I've always said, on our own part, we will ensure that we facilitate the licensing of all the relevant medical and dental personnel who are going to be participating in this. And of course, as NDSM will also synergize and try to link up all the relevant agencies and hospitals and institutions and organizations who are coming, so that we can have a seamless program.
I want to add that, please, as we look at this initiative, it should be patient-centered, as she said, but in addition, whole person health, because that will combine other health, social determinants of health to really make it high-quality care for our people. Similarly, I didn't hear much about mental health. I think it's a critical component of care to be integrated in whatever health initiatives we are doing. And finally, please, I will strongly recommend that respectful patient-provider initiative training should be incorporated in that, because our customers are our patients, and we need to treat them respectfully and communicate with them, just like we have proper customer care in the West.
For AMPA, we're starting a bit early, as Honorable Advocate W has mentioned. We're going in April to Imo and Abia states. And we're doing several things, not just the medical, surgical, dental, eye care. A lot of training for capacity building, including in essential newborn care, in basic life support and CPR. We have chronic kidney disease seminar, very common problem. We have menstruation education for our girls, very important, also sex education. We have mental wellness and happiness workshop. Somebody mentioned mental health. AMPA is already doing it. In fact, we started our ECHO program, ECHO, on mental health and child health.
Apart from the ongoing online lecture that we are doing in Germany regarding the cardiology and rhythmology, and also the planned, which is supposed to be for next year, the heart intervention, cardiology, and also possible exchange program, which will be coordinated with universities here and also with our colleagues in that area. We are planning this year pilot projects for cervical cancer screening.
Bread for Life has been focused on specifically interventions, especially in the area of reducing neonatal mortality rates in Nigeria.
It's a pleasure for Nigerian Doctors Forum in South Africa to be part of this initiative. This is one of our pilot projects that we are excited to be part of. We have 3 major programs which will be led by 3 faculties, which we will be showcasing in the DHII. And those 3 programs involve neurosurgery, it involves gastroendoscopy, and it involves the use of interventional radiology in the treatment of uterine fibroid.
Our work in this exciting program is to work in the south-south zone of Nigeria, with particular focus in Benin City, where we are going to be training at least 60 gynecologists, radiologists, and sonographers on how to diagnose endometriosis non-invasively with ultrasound.
I want to suggest and ask that because we have a large body of knowledge, information, and we have so many people, that we make it to be in the training programs, both from people from Diaspora and even people in Nigeria, that will have a lot on cardiac arrest, CPR, and emergency resuscitation, and also emergency services.
My appeal is a simple one, that if you remember during the COVID period, and the role of critical care physicians in the management of patients who are very ill, I appeal that we should also include critical care in our programs. We have many Nigerians who are in Canada, Australia, UK, and in the US, who are doing extremely well in critical care. They practice as critical care physicians, intensivists, I mean. And then we are finding it difficult as a society to have access to this group of Nigerians. So may this forum also serve as the rarest privilege to have them, interface with us. We run a 5-monthly webinar series, which is one of the platforms we use to educate ourselves and build capacity.
Many thanks to NIDCOM for this initiative to improve healthcare delivery in Nigeria. We take a short break. The Diaspora continues shortly.
We carry our roots wherever we roam. Our culture and pride forever our home. Nigerians in diaspora, we're strong and but bold. Our spirit unbroken, our hearts made of gold. We rise above borders, our love for Nigeria stays in our hearts, our homeland, every single day. From America to Europe.
Welcome back. Now to our health tip segment with Amper Doctor.
You can perform on your own as an individual without necessarily going to see your physician. These include, number 1, maintaining a healthy weight. A healthy weight, as calculated by your body mass index, is your weight in relation to your height. For instance, somebody who is 6 feet should or could weigh the same as somebody who is 5 feet if that person is overweight. So for every weight, there's an expectation where your weight should be that is a healthy calculated weight.
Next is our food corner with Barbara. Babs, what's on the menu?
Thank you so much, Julie. Today we'll be traveling all the way to Akwa Ibom State, and guess what? Without transportation. Today we'll be going through the steps on how to make what is called abak soup. This soup is mostly eaten by the Akwa Ibom State and Cross River State. It is very simple to make. I call it the marry me soup. You can eat it with swallow or with white rice. Very easy to make. Join me as we go through the steps on how to make this. And boom! Very simple, right? Thank you so much for joining us on Food Corner today. I remain Barbara Bisong. See you next week.
Thank you, Barbara, for that delicious meal. Now to our diaspora of the moment with Esther Otiotio presenting.
Our diaspora of the moment is Oluwumi Olakpeju Mosako. Oluwumi Olakpeju Mosako was born in Zaria, Nigeria, to 2 Yoruba professors. Wumi Mosako moved to Manchester, England at just 1 year old. Growing up as a Nigerian immigrant in England, she navigated the challenges of cultural adaptation that will quietly shape her emotional depth and authenticity. Formerly trained at the prestigious Royal Academy of Dramatic Arts, RADA, Mosako built a career steadily across British theatre and television before breaking through internationally. In 2017, she made history as only the second Black woman to win a BAFTA TV award, claiming Best Supporting Actress for her role in Damilola, Our Beloved Boy. She continued her ascent with critically acclaimed roles in HBO's Lovecraft Country and Netflix His House, before joining the Marvel Cinematic Universe as Hunter B-15 in Loki and Deadpool and Wolverine. In 2026, she won the Gotham Independent Film Award for Outstanding Performance and Best Supporting Actress at the 17th Annual African American Film Critics Association AAFCA Awards for the role, while also picking up nominations for an Academy Award, a Critics' Choice Movie Award, and a Screen Actors Guild Award. From Zaria to the world's biggest award stages, Wumi Mosaku's journey is a testament to talent, tenacity, and the quiet power of staying true to one's roots. She is today one of the most decorated Nigerian-born performers, working in international cinema, and by all indications, she is just getting started. Congratulations, Oluwumi Olakpeju Mosaku. We celebrate you as our diaspora of the moment.
That has been the diaspora for this week. Keep a date with us next week for another interesting episode of your favorite show, The Diaspora. I remain Juliana Vincent Chekubu. Stay positive.